Hello, everybody. Welcome back to Burst TV. My name is Charlotte. And today on Burst TV, I've got a very special guest, this pretty lady over here. Her name is Sara Jane Snyder, and she's a fellow dental hygienist. She also has her bachelor's degree, so, we have a lot in common there. She also has spoken to my previous employer, which this is just like 6 degrees of separation. You always have something in common with someone. And I reached out to her today because we're going to get really nerdy about photobiomodulation. Sara, thank you for joining me today. I really, really appreciate your time.
Yeah, absolutely. Thanks for having me.
So I get a little annoyed with the whole typical, hey, let's get to know Sara. Let me read her bio. So instead, I want to do something fun. Somebody gave me a little book years ago, and I pulled it out before I recycle this. We're going to do a little quick icebreaker, if you don't mind. So just tell me when to stop.
Stop.
Okay. If you had to describe the sneakiest thing that you and your friends have ever done, what was that?
Sneakiest thing. Oh, this is bad. It's bad, but like in a childish way. Like this is something that very much children would do.
Yeah.
Our sneakiest thing that we did, which I kind of feel bad. Sorry, Tatamy. I live in a very small town, and in my very small town, when we were really little in middle school, the sneakiest thing that we did was we would switch lawn ornaments on people. So if the house on the right had like a gnome and the house on the left had a flamingo, we would switch them as like a joke. We didn't like destroy anything. We thought it was hilarious. It was very sneaky.
That's really not that sneaky.
If
that's the sneakiest thing, well, I mean, you got away with it. So yeah, super sneaky. I'd still be okay if you did that like this year.
Yeah.
Because I still think it's funny. Like nobody's getting hurt. It's not like you're destroying anything. You're just.
Oh, our parents were livid when they found out.
Okay, I'll answer this too. Kind of along the same lines, but I did go in for a group TP of someone's house. And I do feel bad about that because we got super creative. There was like honey under door handles and
oh my goodness,
eggs and toilet paper, lots of toilet paper. So that was very destructive. And I'm sorry. I don't even know whose house it was. And so how awful is that? Like mean girl syndrome. That I'm just like, oh yeah, this sounds like fun. And now that I'm a parent and I realize who has to clean that up, I would never condone that. Please don't do that, anybody.
Yeah.
Just don't even wish bad things to happen, because I feel like it's going to come back around to me at some point. I will not be surprised.
Your house be TP'd.
And I'll be fine. I'll be fine if my house gets TP'd.
Karma.
Yeah. Oh, okay, so on to some nerdy stuff.
Yeah.
Photobiomodulation, that's the fancy word for what happens when we use this cold laser. It's been used for many, many years. I'm just going to give like a quick wrap up on what I know about it, and then I'll let you jump in because I really just have 4 questions for you. But it can be used for sports injuries, arthritic joints, pain syndromes of all kinds, head, neck, and back pain. We used to use it on ourselves in the office when we were having shoulder, neck pain as dental professionals. There's so many trials. It's been used over in Europe for a long time. It seems like, I'm sorry, US, but we're not the best in that category. Some medical things take a little bit longer to trickle down and for everybody to see their value here. That's my personal opinion. But in the dental realm, you can use it for speeding up healing processes. When you place implants, post-extraction pain, when people have paresthesia where they're feeling numb, we use it a lot for jaw dysfunctions, hypersensitivity. There's different, you've got a big wand here, you've got an intraoral wand, herpes, you've got Bell's palsy, periodontal disease, aphthous ulcers, especially, and this is what Annette Quinn and I were talking about, are like all these ulcerations that come from chemotherapy treatment and radiation treatment. So it is a potentially life-changing option that you have to offer your patients. So we talked about that from a caregiver standpoint and the value there. But today with you, Sara, I want to talk about how this works. I want to do this from a dental perspective where the general public that happened upon this channel would also get a good understanding for how this works.
Yeah. So it's called photobiomodulation, and that term really wasn't coined until 2018. Before that, it came by so many different names, like you had mentioned earlier, cold laser or LLT, low level laser therapy. I mean, there's still so many different names out there. And that's kind of something I want to stress too. Like when you are trying to Google, because a lot of times people will say to me, it's like, why don't I know about this? And I tried to research it and there's not enough stuff out there. There is tons of things out there, but the name is so like varied that it's kind of hard to pinpoint what you're looking for. We actually have a database that we search 100 different names and then an additional 200 different terms. So that's 300 different things just to find all of the published studies on photobiomodulation. And that just gives you an idea as to how vast the name category is for this technology. But yeah, so it's called photobiomodulation, which is very much describing what this technology does. Photo meaning light, bio meaning life, so cells, and modulation, the ability to change. So that's very important. And I'm gonna show a slide really quickly, and we're gonna get a little bit nerdy as to what the mechanism of action is, or the leading mechanism of action at this time, of how this kind of works in the cell. So the leading mechanism of action is that you have a happy cell. We have, 3.7 billion trillion cells in the human body. So you have a happy normal cell like this, and inside the cell you have the electron transport chain, and that happens in the powerhouse of the cell in what's called the mitochondria. So cytochrome C oxidase is inside mitochondria, and this is where the electron transport chain happens. And what happens is oxygen comes into the cell, it binds with cytochrome C oxidase, and it creates something called ATP, or cellular energy. This is what the cell needs in order to thrive. But what happens is when we're sick, stressed, or just old, nitric oxide will bind with cytochrome C oxidase, and this will displace oxygen. This usually leads to the creation of ROS, free radicals, reactive oxygen species. And what free radicals do is the leading cause to inflammation and pain within the body, and eventually it would cause cell death. But what we found is by shining light at a certain wavelength and at a certain dose, we can actually displace the nitric oxide from the cytochrome C oxidase, which will reallow oxygen to bind with cytochrome C oxidase, increasing ATP and cellular energy. And that's the leading mechanism of action. And what's really great about this is it's so simple. And that simple thing as making stressed cells unstressed and increasing the energy within the cell can be applied to so many different things. And that's what people constantly ask me is, why is it that you can treat back pain, and then you can treat paresthesia, and then you can treat, like, it seems like snake oil.
Well, and I'm thinking too, like we're so focused on free radicals with our skin too.
It's pretty incredible.
So that's amazing that, you know, you can apply it to throughout the body. I mean, I even saw on your website, they have, it looks like a tanning bed.
Yes, that's our
Nova. This. Like people actually have a whole low-level laser bed.
Yeah, so that is our Nova THOR. It's amazing. It's a full bed, and you lay in it, and it just hits all of your lymphatics, which is great for circulation and helping to reduce inflammation. It hits the site of the injury, so say it's like back pain or something. There's also something called myofascial trigger points, which are bundles of nerves that hold fluid. We have a special probe that will actually detect them, so you don't have to palpate, which is very difficult when you're working with small.
Now, is that the one little probe where it almost sounds like a Geiger, where you're going in and then it hits a certain point? What exactly is it measuring? Because I was so fascinated with that, and we would, again, someone would try to explain it to me, And I'm like, yeah, but how? Not just, well, it shows you where it's at. I'm like, I can see, I know, I can hear where it's a trigger point. I've got this fluid, this something's wrong right here. What is it detecting?
Well, that's exactly it. It's detecting the fluid.
Okay. All right.
So it's just detecting those spikes. It spikes when it detects the fluid and the pressure. So it's also like heat as well. So like if somebody's really sweaty and they're coming off the street to your dental practice and you go to use it on in, their numbers are going to be jumping a little bit higher. So it's detecting fluid.
Gotcha. So THOR, how long has the company THOR been around?
Forever.
Long.
A very long time. So our company is based in London, UK. And our CEO and founder, James Carroll, who's amazing, he has written so many papers, I think over 40 academic papers, some with Harvard. He gives presentations all around the world. We're very global. We've been in practice, I want to say close to 40 years now. You know,
yeah, I was thinking around 30, 40 years from what I remembered.
Yeah.
You guys watching, if you've heard of THOR, if you've used it, drop a comment real quick, like this is what we use it for. Just give me a little conversation. If this is all brand new to you, please do leave a comment, because I kind of want to gauge to see, you know, like how many people have even come across this technology before. So very interesting. When you're using, let's go back to, because you know my brain is like all over the place, but let's bring it back to a dental practice. In a dental practice, what kind of precautions do you need to take? I know the answer, but I want to make sure that you give the right answer for the audience. Because some people are like, oh my God, it's a laser. It might shoot my eye out. It can't hit the wall. You know, how powerful is this thing? What kind of distance are we talking about? And then precautions. What do we need to do to keep our patients safe?
Yeah, so I think the first thing I want to say is that there's many different classes of lasers that people really don't understand. Laser does seem like a scary term. I mean, I've had some phone calls where people are like, can I use this with a room with windows? Like, should I take off my jewelry? And yeah, that's a precaution when you're dealing with surgery lasers. So the two main lasers that we really want to talk about, we are a class 3B laser, which is different than a class 4 laser. A class 4 laser is what you usually associate with surgery. It's ablating, so it cuts tissue. And those are the ones where you have to take a lot of precautions in the sense of, you know, having the door closed, you know, wearing safety glasses, making sure
sign up, make sure people don't come in.
All of that stuff, yes. We have a class 3B laser. So that is very gentle. It's also diffuse beams. It's not coherent beams. So that means the photon energy is not going directly at the site that it's pointing at. It's a little bit more diffuse.
Okay.
And that just makes it safer. So yeah.
Do you have to wear goggles?
So you do have to wear goggles when you're using the actual laser one. But we do have an LED one, and this one, I can shine it right in my eye.
Yeah, because that was alarming the first time I walked in on my previous employer, and he was shining this on his eyes. I'm like, I'm not sure that you should do that. He goes, no, it's totally fine. It's been known to help reduce your risk for glaucoma or slow down the process. You know, it's like that's
age-related macular degeneration. We have a device that's had some research. It's our sister company, Lumithera, and they use the LED for the eye. We have people who go on the THOR and they say that they feel that their eyes have gotten better. So always wear the safety glasses, especially when you're with patients. But if it's not with patients, I mean, I treat myself all the time with the actual laser one, and I don't wear glasses, which is probably bad for me to say, but it's because, again, a difference with our laser versus a class 4 laser is you have direct contact with the skin. And by applying direct contact to the skin, there's really nothing coming out. And again, it's a diffuse beam. So even if I were to accidentally take the laser and pull it away from myself, it's not directly going into my eye, it diffuses. So it gets weaker the further you pull it away.
Gotcha.
So similar to like x-rays, you know, when you take x-rays that scatter, you need to make sure that you're so far away so that you're not in contact. I mean,
you have to have a focus beam. Yeah.
Yeah.
So here's another big question, because, you know, this kind of technology, it is an investment. And I personally saw the benefits. We treated a lot of patients that had burning mouth syndrome, ulcers of all kinds, jaw issues, headaches, a lot of TMD dysfunction, a lot of TMJ dysfunction. But the struggle there was getting compensated, because we have to face the fact that we are in an insurance driven realm. But in a dental practice, let's start with this. What can you legally treat, and what do you need to stay away from in your
dental practice? You can treat anything within the head and neck.
Okay.
Because that's what we're licensed to do, is treat anything within the head and neck. So if somebody's having neck pain and it's associated to, say, TMJ, which is possible, you can have,
a lot of times it is, for sure.
You can have pain like near the occipital lobe, and it's causing tension headaches, which is also causing TMJ and stress. So yeah, anything within the head and neck. As you mentioned before, TMJ, trismus, those are huge. Post-op healing after extractions, helping prevent from dry sockets and increase healing. Paresthesia, trigeminal neuralgia, post-herpetic neuralgia, those really hard things that there really isn't anything for, right?
Right.
So
when it comes into, are there I know you guys probably teach all of this in your training sessions, and we don't need to go like so far into it, but just, are there a good amount of dental insurance codes that are accepted, or are we just not quite at that point?
The short answer, we're not quite at that point. There are some codes, but there are some codes, but it's still undefined as to how much is getting it and who's actually getting it. And it has to do with the description that you write with the code, that it will
and still, it varies from one insurance company to the next. And for just the patients out there that don't know much about billing and coding, we offered this as a cash pay procedure. We knew the benefits. We had the reviews from patients. We knew that it worked. So that was something that they would just pay out of pocket. We would try to get compensated for it, but at some point, I feel like you as a patient, you've got your insurance with a coupon, which is great. Use all the coupons that you have, but sometimes you just need more than what an insurance company is going to offer you, which is the minimum to stay on a healthy path. If you have conditions, whether it's with your teeth or your medical conditions that make you a little higher maintenance, it's up to you to find ways to resolve those. So I think THOR is a really good alternative to some more extensive procedures that might be covered by insurance. Going to a specialist, you might be able to intercept some problems before they get to a point where you've got to take that next step. The other cool thing is, I know that your website has all kinds of information on, again, you can repeat how this works and, the general overview, either from a clinician standpoint. If somebody wants to have a one-on-one, they can find somebody to talk to about this. And if from a consumer standpoint, they've got more general information. But what does someone do if they want to find out where's a dentist in my area that has this option? What can they do?
They can contact us at our website and say, hey, I'm looking for someone in this area. Are there any practitioners? And we'll send you an email of a list of whoever's within your area that you can see. Another thing I wanted to touch on is, when you were talking about insurance, I do know a decent amount of dentists who just do the treatment for free because it increases patient outcomes.
Yeah, well, I can, especially in the oral surgery realm, or anytime you're doing extractions or something that's inherently traumatic, which a lot of things can be, even after you do an implant. Some people have no post-op pain, and some people they just need a little extra, a little more sensitive. But listen, Sara, I'm not going to take up any more of your time, but I really, really appreciate you coming on today. I am so excited about technologies like this, and I hope at some point every dental practice will just have one.
I agree. I agree.
And I feel like I need one now, just to have one for myself. I did treat myself. My hamstring, pulled a middle hamstring, and I'm telling you, they told me I'd be off my feet, or off the running for about 2 weeks. And I was sarajane again. It's amazing.
Yes.
It works.
Yes, it's so great. And can I show my new probe?
Oh yeah.
So we have this amazing probe, and this would be great for dentistry. You see, it's like a little lollipop.
Oh, what?
You want to see it work?
Then you get everything.
Mm-hmm.
Oh, that's so cool. So you don't have to turn the wand and redirect it.
It's 1 minute. 1 minute.
I'm so excited.
So, like, think about it, for orthodontics, for increasing teeth movement, for gingival inflammation, perio, there's, 1 minute.
Oh, I love that. That's cool. Thank you so much for showing me that.
Yeah.
Very neat. And if you guys want to reach out to Sara, I'm going to leave all of her contact information in the description. And if you thought this was mildly entertaining or educational, please do give us a thumbs up and let us know that you were here. Thank you guys. Thanks again, Sara. We'll see you next time on Boost TV.
Bye-bye.